So we see men really come up for assessment. I mean, they will tell you that, a friend has passed on, or a friend is getting to this difficulty, and so I want to come because I see this, the difficulties my friends are in. So it keeps changing. But we also get men who tell us that my wife told me that if I don't come to the hospital, don't come home. And a few times they actually call their wives and have to take the phone to confirm that
I am in the hospital.
I am in the hospital and this is Dr. Che speaking to you. Then they are okay. So we hope you to get to a point.
But why is it like that?
I think men, we want the machoism. I think we want to keep going until we really can't move a limb.
Anymore.
And that is it. So even though the mothers and the wives and ladies can tell that you are not your usual self, we don't seem to see it until we try to get up from the bed and we can't just step
anymore.
up. Then we realize that there's something quite.
So what they feel like once you keep going to the hospital, I'm not well, you come across like a weakling.
Probably. No, probably. Because, sometimes people really don't want to see you in the normal trend of things. Mm-hmm. Can you see me out of the normal line? Because they don't want people to see that
there's something wrong with them.
They are in control. But the body sometimes gives up on us, and we need to recognize that.
Okay, but we are telling you this morning, we the women in your life, we love you. And we're telling you this morning that your health matters to us as well. So when you don't feel unwell, please go to the hospital. And even if you think you're well and we notice and we're telling you that, oh no, looks like you have to see the doctor, please do. It's important to us because we need you to be strong at all times. And just know that we love you. So let me get to my first question that came through. It says that, where did you go to? The question basically was asking that every time he coughs, he ejaculates, or he comes with a cough, and he wants to find out why that is so.
Yes, it's quite interesting. I must admit, probably this is the first time I've come across something like this. We have the whole system is a nervous system that works. So we are tempted to look at things from the organic point of view, where we are looking at whether is there anything wrong with the network system, such that once the nerves are stimulated, because ejaculation is for us as in medicine, we say that it's purely an issue with the sympathetics. And if there's any trigger of the sympathetics and there's some communication, it can cause you to cough. It can also be psychological. You feel a bit of a throat, a bit of firing of the nerves, and your response is to cough. So I must say that this is quite a new thing to me. I have to go and read more about it and work on it. Probably the next time around, I may have an answer.
Okay, great.
But it's a great question.
Great. And I think it's bothering him because he says this every time. So we'll be very glad if you could find answers for us.
I would. I would.
Thank
it's a challenge.
you.
I will take it up.
This one says, Dem, I am 34. I work in a bank and have had persistent backaches for the past 4 years. Anytime I sit when I get to work, I have burning sensations till I leave for home. This won't go until I'm out of the office or standing upright. What could this be? This is from Felix in Kufredia.
Good. I think back pain is quite a broad topic. Back pain is quite a broad topic. We are interested in his age. But one thing that strikes me is the fact that it's when he goes to work. And so you ask yourself, how is the ergonometry? How do you sit, in the office? What is the type of chair you use? Are you somebody who sits all day, don't get up to stretch out? So it needs to be interrogated more. If it is across board, in the car, at home, they think that probably there's something wrong. You've got the orthopedic surgeons to help. You've got the neurosurgeons to help. But it looks more like something related to work, because they are occupational therapists as well. I think you just have to approach a generalist who analyze and see which specialty can be of help. But to a start, I think we need to change his chair.
Okay. You didn't mention that you had seen a doctor, but if it's been persistent and it's giving you worries, then it was about time that you spoke to, a health expert to find out what really is wrong with you. But doc says that to begin with, you should have a change of chair. Now, good morning. Please, I have some rashes on my penis. So I went for checkup at the hospital and I was told it wasn't an STD. However, the rashes are still there. What drugs should I use, or do I need further tests?
Okay, so I'll say that the penis and the skin on it is in continuum with the whole body skin. So when you have got the rashes on the penis, it's either because it's a localized problem, whereby then we tend to associate it with, sexual activity and picking an infection from sex, or as part of the general skin problem. So you may have a patch on your face and have a patch on the penis. Then we are looking at generalized dermatitis or something that needs to see a dermatologist. But if it is localized to the penis, then the urologist could be of help. So we need to understand what is happening. Now, when we look at a rash and we have good difficulty, we can take what we call a biopsy. That will then go to the laboratory, they put it on a microscope, and they may identify, let's say, a fungal infection. They may identify some cells that may say that it's probably allergic reaction. Because you may see a rash and maybe it's allergic to condom, allergic to some other, even sometimes even the kind of underwear that we use. And once we go through this process, we can be able to deal with it. So, first, yes, sexual issues. There's a few lab tests that we run. Once they tell him that it is not related to a sexual infection, probably they may have gone through all the laboratory tests and they have not. I must say that there are a few creams. Sometimes when you are pushed the wall, we take creams that contain something for infection, the fungal, something for viral, and something probably for allergic reaction. When you decide to take such creams, which are multiple creams together, then you have to use it for a very short time, probably a week or two, and then when you stop, it's over. But if it doesn't, then we need to take what we call a biopsy, or a punch biopsy, for it to analyze it. Because sometimes it can be a rash and it can be a cancer, the beginning of a cancer. Okay. So if it's persistent, probably we need to at least check again, probably take a punch of it. If it is bacteria or viral or it is fungal, they can help us. If it's getting to something cancerous, we can get an answer. We're told.
So I think, he answered himself when he asked if he needs to do further investigations.
That's right.
So the answer is yes. Yeah. If you think that where you went first, probably you didn't get the help you need, please seek it elsewhere.
A dermatologist would be a great
asset. And have further examinations. Okay, this one says, hello, I used to wet my bed as a child up until the age of 15. I sought treatment at the hospital and it stopped. Now I am about 32 years. I could pee up to about 5 times at night before daybreak. What could be the reason? Any treatment? I am really disturbed.
Okay. When you urinate about 5 times in the night, we will refer to as nocturia. But it's also important to ask what time you go to bed and what time you wake up. Because the average person can hold urine for only about 2 or 3 hours and you may have to pee. So if you go to bed at 8 p.m. and you get up at somewhere 7 a.m., then urinating 5 times may be quite normal. But of course, 35-year-old, we expect that you may be very active and probably don't spend that much time in bed. The next question we want to ask ourselves is, how much water do you take? When you're taking water, we are looking at you sweating it out, breathing a bit of it out as a vapor, and then passing urine. So if you drink a bit more water than usual, probably more than 2 liters, then you may likely to pass more urine than you expect. Especially if you end up sleeping in an air conditioner or probably a high, an enclosed area, that can be something that will happen. We also look at diabetes. Sometimes we think that diabetes starts after age 60, but you can have diabetes as young as 15 years or even virtually in 5 years
younger.
Old. Yeah. So 35-year-old, a lot of, passing a lot of fluid at night, probably we need to check the sugar level to make sure that you are not developing diabetes. We also, of course, look at the medications you are on. If they have diagnosed you for hypertension, if started on medication, some of the medicines we use for hypertension is actually helping you to pee more so that we can reduce the blood volume and so help get the blood pressure down. So nocturia is quite varied causes and we need to understand. But to start, I would say check your fluid intake and probably if you reduce it, that should be able to help the situation. Watch alcohol intake, watch coffee and tea intake, which can irritate the bladder and cause you to urinate more frequently than usual. And then probably to get the sugar check as a baseline. Going forward, we may look at the kidneys and other things, but that one, the doctors, after this preliminary assessment, if they think we need further workup, that will be done.
Okay. So it means that it could be a myriad of things.
A myriad of things, yes.
So what you have to do is, yes, you sought help when you were young, and the peeing problem, the wetting of the bed stopped. If now this one, doc is saying that you will also have to go back to the hospital and have yourself checked. So please. No machoism.
Yeah, it might not be related. I mean it might not be related at all.
Yeah. So please, once it gives you cause for concern, I say this all the time. Why don't you just approach a health facility and find out what's wrong with you so that your fears are allayed? My husband is 57 years. And it's difficult to get. I know that a lot of young children, I have a lot of young friends, my kids, their classmates and all, some of them listen to Home Affairs. But judging from the conversation and some of the questions that are coming up, maybe a little bit of child sensitive. So I think that parents just monitor and then know what you want them to listen to and just be cautious. It's nothing explicit, but my husband is 57 and finds it difficult to get an erection, and even when he does, he's unable to sustain it. What can we do? This is from Chrono in Accra.
Okay, so getting difficulty of erection, what we call erectile dysfunction, is quite a difficult challenge for couples. His age is 57, and probably, as we say, that will open up the panoramic box on various causes of that. For you to achieve an erection, first the nervous system must work well. You must have the psyche for it to work. The blood vessels must work well because blood must flow through the piping system or the arteries to get to the penis for the erection to happen. You need a good hormones. Important thing for us is the testosterone. But sometimes even some other hormones can be a reason why the erections are not too good. You also have to always have a good penis as well. So these are all areas that you may have to look at to be able to judge what is happening. At his age 57, what we call organic causes, probably looking at the blood pressure, looking at the fat levels, looking at the sugar levels, which may all affect the nerves. Looking at whether he has had any surgeries at all, which may have caused damage to the blood supply to the penis. Look at diseases in the pelvis, especially prostate diseases, whether infection or an enlargement or a cancer or even a rectal problem. So there's quite a lot of issues to be addressed. We would divide it into what we call organic, when we think there is something wrong with the anatomy, or psychology, when we think that there is something really probably at the level of the brain or the psyche. One important information we did not get from the question is, how long has it been going on? If it is less than 3 months, probably it may just be the beginning of something just minor. A malaria that probably took too much toll on him, stress out at work, financial challenges he's going to, currently cannot be psychological issues, political challenges and stresses. So there could be a lot of things that may be the reason within the short time. And most of this corrects once the stress has been taken off. But if it's more than 3 months, then we may want to look at these general issues. I've talked about a lot of things, but a good history, talking to you can help us narrow it down to one or two things that we can easily tackle and get it through. While even we are at it, we have very, very good medications that we can use, which will not upset the system too much. And once we start those medications, we should be well. So we can solve the problem in a temporary way and then try and understand it, talking to you and doing a few investigations and get a permanent solution. 57, I think we should be able to solve the problem. We should be able to solve the problem.
Okay, so 57, don't give up on yourself. There's help out there. So just go out there and then get help. This one says, please advise on vasectomy in Ghana and what it can be done. It's from Kofi Intebo. And he adds, especially a Ghanaian man like me.
Thank you very much. I think it's very interesting and very happy that a man is talking about vasectomy. It's a good contraceptive method, quite permanent, and takes the stress from the couple, and I think it's a good thing. Urologists do vasectomy, and gynecologists have also been trained to do vasectomy. Okay. So it should not be difficult finding a place to do. Talk to any urologist at all; they can be able to do it for you. It's a short procedure, sometimes as short as 10 minutes or 15 minutes.
Oh, okay.
And then it is done.
And it's not painful.
It's a local injection. So we talk to you, we are talking to you, a few injections here and there, and then it can be done. Probably 1 or 2 injections, and then the whole place is numb to be done. But it's important to appreciate that it is a permanent procedure. Once we do it, we don't intend irreversible. So we advise that probably you should be a bit advanced in age. In quote, in other words, your late 30s and your 40s is much
How old
more
is he?
advisable.
Okay, he didn't mention his age.
Yes, because when you want to a reversal, that can be challenged. Some people come for a reversal because probably the first marriage is not going too well, new marriage.
Eish.
Or now they have a little bit for us one couple, they now have a little more money and they've got now 5-bedroom house and they think that the 2 kids are too few. They want more, so they will change up their mind along the line. So it's a good contraceptive method, straightforward, within 15 minutes is done.
Does it affect potency in any way? Some of the concerns people have.
Not at all. They are 2 different systems. Not at all. In fact, it tends to enhance, because once the fear of, getting an unwanted, baby gets out,
You have a
probably
clear mind.
they tend to do much better. Better.
Okay, so that's Doc's advice. Yes, it can be done. It's not a difficult thing. A very short procedure. Doesn't take too much time. And then just be sure you want it. And then once you're sure you want it, you can always get it. Okay, great. Let me move on. But the phone lines are also activated, 0302216541. So you can also call in and ask your question. This one says that, good morning, there is a very serious itch in my anus, and the under of my testicles is always wet. What's the problem?
Okay, so what we refer to as pruritus hernia, that is itching around the anus. One of the first things we want to look at is the normal worms that we know of. Okay. They can be able to cause a lot of it. So a worm treatment should be able to help. Another important cause is when you have got lesions around the inner area. It can just be an abscess or an infection, or it can also be a very serious issue like a rectal or an anorectal, cancer or tumor, which is producing a lot of, mucoid fluid and therefore leading to irritations in the area. So, to start with, I say that just get some worm treatment and then take it. But if it is still persistent, then we may need to examine you in the inner area. If you ask my opinion, probably a general practitioner can be able to start with. And if you think that there's something that requires the general surgeon's attention or the colorectal specialist attention because it's around the inner area or the rectal area, they can be able to help you out. But probably a worm treatment to start with should do. And then we can move on if
and
it doesn't
he can
work.
get it over the counter, or he
For worm treatment, he can't get over the counter. The pharmacist can be of help.
Okay, so when you, for instance, take the worm treatment, after how much time do you probably have to see the doctor?
I'll give you 3 weeks.
Okay.
Because that's said, if it is something serious like a cancer, then we don't want to waste too much time. If a worm treatment, within the first week or 2, you should resolve.
You should stop, but if it doesn't after about a week or 2, then
we
you
need
know
to examine the area.
Okay, great. This one says that, good morning, my physician specialist diagnosed that I have acid reflux, and I think GERD, is that it?
That's right.
Okay. Several visits to the hospital has not produced a cure. I am told it can only be managed and can't be cured. This situation often gives me a sense of offensive breath and producing mucus in the throat and cyanosis anytime I eat. Adam, please, can Doc assist me with any help of cure? This is from Kwame Nadenta.
Okay,
wow.
Good. So, as you said, this acid reflux means that, acid builds up in the stomach and then comes up into the esophagus and gives you all this pain, burning sensation, nausea, and things. Normally, we do what we call, endoscopy, an upper GI endoscopy, to make sure that there's no other thing that is causing the reflux, no growth there, no patency. Sometimes we do an X-ray to be sure that there's no what to call, hiatus hernia, some part of the bowel moving into, the chest cavity. So I presume that if he said he has been checked up, we have got the endoscopy done and probably have got the X-ray done to make sure that it's not a hiatus hernia. The next important thing is weight gain. If you are quite obese, then the intra-abdominal pressure can be so high as to, get the pressure into the stomach, and of course, the stomach, then the pressure in there overcomes the control, the sphincter at the esophagogastric junction, and then you can have the reflux. So we want to know, is he obese? Then probably weight loss could be an adjunct to whatever treatment that he is undergoing. Eating late at night can also be an issue. So we may advise that probably maybe after maybe 6 or 7 p.m., he should not take any more diet, because once you take a lot of diet and you lie supine or lie flat, then you can get the acid coming. When we are pushed to the wall, then sometimes we actually put you permanently on some of this anti-medication, anti-acid medication. So probably take 1 tablet a day to be able to help. Sometimes can be due because of massive obesity. Then we can do surgeries on the stomach, trying to reduce the stomach capacity and so help you reduce weight, not the natural way, but through the surgical means. And that can also be able to solve it. So if he's not getting any difficulty, we have got what's called a gastroenterologist. Now, a lot of sub-specializations coming into the system. Let him get a referral to see a gastroenterologist, and then they can tell him what is available in the country.
And he can see one at Kolebu.
Or can see one at Kolebu, not on the medical side. And the truth is that if you don't have the expertise in Ghana, we will help you identify where you can get expertise to deal with it. Especially if you have to do a gastric surgery, what we call a bariatric surgery, and because of your habitus and because of other reasons, what we have here may not help you. We can recommend where you can go to get it sorted out.
So Kwame, don't despair. It's not that's not the end of the world for you.
Yeah.
So there's help out there. Okay. Someone is asking, what causes delayed ejaculation?
Okay. Good. So what is a normal ejaculation? The average man
Doc, just hold on a little bit. I have somebody on the line. So then. Hello, Andrew.
Yeah, good morning.
Good morning, Andrew. How are you?
Yeah, normal.
Okay, great. Which one is normal? I'm interested.
Concerning the dysfunction of the genital, the man should depend on vegetables. It's a contribution to your radio doctor. He's doing well. And live on less fatty foods and make exercise. I'm about 60 years. But my genitals is like a cruise missile. It's working all right. So to have such a situation, it will not make the family happy. So the man should always make exercise, depend on vegetables, ademe, boma, and kotombre. Should depend on them always. And money mix.
Hey.
So I'm okay. I have experienced such a thing before, but now I'm like a cruise missile.
Wow.
And my home is happy. Okay.
All right. Thank you very much.
Thank you very much, Andrew. I think intervention is quite important. But as I said, his age is 57 and there could be an underlying problem.
Exactly.
So once we get that out of the way, I agree with him, the exercise and the diet could be much helpful.
Because at that age, if you are not already exercising and you don't know your strength, it's important that you still see a doctor. You could be even advised on what exercise to undertake, because you could go start yourself off on some exercises and you might be worsening your problem.
That's right.
So if he hasn't been doing all of these, I think it's still not bad to go see a doctor and then discuss all of these, know what your options are, and then we're praying that everything works together for good.
A good
but that's a good one there. Means that for the young ones who are listening, like, start like now. You don't get to 57 or 60 before you start seeking help. So less oil, he says. Eat a lot of greens, vegetables. I don't know what the momoni mix is. And then exercise. He says it's like what? Currently it's what?
Cruise missile.
Wow. Okay, great. Yes, we're talking about delayed ejaculation.
Good. So, as I said, the average man may be able to intravaginally stay for about 6 minutes before ejaculation. Because it can go longer, sometimes it can be shorter. So, delayed means that probably it's still longer than 6 minutes, and probably the partner is complaining that you are staying too long. What happens? In the ejaculation, I said, is the nerves.
6 minutes. Hey, these young men have been having conversations. Some people think that you have to be on it for like an hour.
The ladies will be upset with you.
I think that when you're able to go that long, you have a problem.
Oh, no, not at all. Because sometimes it becomes quite uncomfortable for the woman. And I've seen women, actually, sometimes they are the men who complain.
Actually, this is from a woman.
That is right. It take a long time. They become dry later on, and then it can be something else. So, what happens? First, the whole system requires the nerves to work well. So if you have got any nerve dysfunction, that can be an issue. One of the things is diabetes causing what we call the neuropathy. So we want to be sure that the nerves are fine, whether it's diabetes, whether it's got a spine problem from sitting or an accident or any other, wear and tear of the spine, that can affect the nerves firing very well. So this is one area we have to look at. Another area is practices. If somebody has been involved in masturbation, then what happens is that the thermostat is set at a rather higher level, and so then I know a gentleman who virtually starts intravaginally and has to end up with masturbation before he can ejaculate, because the thermostat has to start in a quite a bad way. Sometimes too, again, the sensation is not being felt. The sensation is not either because of the woman's level or because of his problem. So that this can be a reason. One of the ways to go around it is probably to increase the foreplay time, so that by the time he's coming in, he's almost at the edge of it. Otherwise, then we need to look at all of these things. We don't have a medication for a delayed ejaculation, so we do a lot of advice and counseling and work around it. So, but as if you're able to identify a reason, why it is happening, especially the nerve conduction is slow, then we try to deal with that from that perspective, and then that can be useful. Yeah.
There's which one is that?
Premature. Yes.
And there's delayed.
That is it. That is it.
Okay. I have a call on the line. Hello, Call. Good morning.
Morning.
Yes, Call. How are you?
By the grace of God, I'm well.
Okay, great. We're listening to you.
I'm having a problem. That's it. And for the past 2 years,
Call, could you speak up for us?
I'm having a problem.
Okay.
I'm diabetic.
Diabetic. Okay.
Yes, for the past 2 years now, I'm not having erection. It doesn't erect at all. It doesn't pick up at all.
Yeah.
And I don't know if I will have a child in the future. I'm 43 years.
43 years. Okay. Good. So, having a child and erection, they are together, but they are separate. The system for getting the sperms out and ejaculation, of course, is separate, but depends on an erection to be able to achieve that. Diabetes and erectile problems is common. As the diabetes affects the blood vessels, it makes them quite narrowed, and so blood is not able to flow to the penis, and also makes the nerves quite, sluggish, and doesn't allow the nerve system to work well. So these are the two things that come together in the diabetic, and it can be challenging. But since it's just 2 years, we are likely to get a good success with our treatment. The longer it stays, the more difficult it comes with us. But generally, 7 out of 10 diabetes, we will be able to help them with the medications and other systems that we have. Once we are able to get the erections in good shape, the ejaculation may, in quote, automatically follow, except a few people. So I think that at 43 years and just 2 years of diabetes, probably we should be able to help. So he should talk to a urologist, and we can be able to help him out. Yeah, I think we should be able to help the situation.
Okay, so the situation can be salvaged.
Yeah.
Just approach a urologist.
Yeah.
Good morning. Please, I always used to scratch or rub my penis, and I've experienced this for almost a year. In doing this, I also reduce the size of my penis. Hey, I'm very worried and I need your advice.
I'm not sure rubbing it should cause a reduction. Maybe probably you are looking at it more frequently than you normally would, and so thinking that yeah. But as I said, probably could be a rash or something, something on the skin that is causing this rubbing. Or are you reacting to a condom or a cream or something? Yeah. And as I said earlier on, yes, it's genital, but sometimes the dermatologist can be very, very helpful because it's part of our skin. So you can have an allergic reaction, which is giving scratches on the skin, and also scratches, on the penile skin, as well as even the mucosa of the penis. So let's get close to a doctor to have a look at it. You can see a dermatologist or urologist, and we can look at it and see. But the rubbing should not affect. No, if you rub to the point of erection, probably that even rather enhance it, because as the penis get engorged, it rather tends to penis tend to rather enlarge and elongate. So we will look at it, but a dermatologist could be helpful, because a urologist could also be helpful.
All right. There's one here that says, "Good morning. I am Nanaya from Kumasi. I just realized through a scan that my 16 months old boy has only one descended testis, and the other one could be found around the abdominal area. I want to know what can be done about this situation."
Okay, so undescended testes, good. So when we are developing in the womb as men, the testis starts in the abdomen around the level where the kidneys are, and then travels all the way into the scrotum. So by the time we are born, almost 90% of boys will have the testes in the scrotum. By probably 3-4 months, most men will have the testes completely in the scrotum. However, sometimes when it's coming down from the kidney area, it may get arrested and may not come into the scrotum. And we don't like it if the testis is there. 2 important reasons. 1, the testis in the abdomen is subject to a very high temperature. So pretty soon it tends to destroy all the lining that will help produce sperms. So that testis then loses its ability to produce sperms. Even though it's able to produce the testosterone that makes you develop all the male sexual characteristics. The second thing is that a testis that is in the abdomen is prone to develop a cancer. So when it is in the abdomen, we want to go and look for it and bring it down, or sometimes have to take it away.
Wow.
At the age of 16, we may want to preserve.
16 months. 16 months.
16 months.
Yes, so that's about 1 year, 4 months.
Yeah.
Or so.
Oh, okay. So 16 months. We may do a few things to look for it. We can look for it. Sometimes we make a bit of a surgery. Oh yes, and bring it down. If it's 16 months, and it depends on the level. Yeah. If it is an abdomen, we may have to look for it. We will bring it down. Yeah. We have ways of manipulating and bringing it down. He's 16 months. We should be able to bring it down. So you should see a pediatric surgeon. A pediatric surgeon will bring it down. If you're a bit older, we do what we call laparoscopy to try and locate it and identify whether the vessels are long enough to bring it down, whether the vas, the tubes for the sperms, are long enough to bring it down. So then it becomes dicey. Either we will be able to bring it down, or we have to remove the testes and then probably discard it.
What causes some of these things?
Generally, we see that probably the hormones. Sometimes, actually, some of the medications that parents take
when they are
pregnant. We see giving mothers folic acid and other things. These are all very, very helpful in preventing some of these abnormalities. Sometimes it runs in the family. That almost every boy, the father had a situation and the kid is also having it. But folic acid has been found useful for most of these programs to help solve it. That's why now we put pregnant women on it. And we avoid a lot of steroid therapy. Energy drinks and other things in pregnancy can be detrimental. So that is it. But 1 year, 4 months, no, it will be brought down. We have maneuvers. It will be brought down. And pediatric urologists, pediatric surgeons should be helpful. Or even any general surgeon are trained to be able to bring it down. Okay. And the earlier we bring it down, the better. Because if we bring it down early, before 2 years, we can spare both the sperm production and the testosterone production, as well as prevent the cancer. So this is the best time to work on him.
Interesting. Wow.
We should make a move.
Okay, so Nanaya, I think your question's been answered. It can be handled. It can be brought down, as Doctor is saying, because not looking for it, not finding it, and making sure it's in the right place could have other health challenges, even to the extent of cancer.
Yeah, and I must say that it's one of the things that is supposed to be done by our midwives. Once a child is born, we're supposed to inspect all of these, so that even right from the beginning, we know that this is the problem, and then working towards when we think it's safe enough to be able to bring it down.
So is there a question we can begin to ask?
Yes.
Like you deliver a boy, and can you just ask the midwife or your gynae or whoever to find out if the both testes have descended?
Yeah, I think it's fair. I mean, the other question we can ask, but I think it's a first move. And when you ask whether it's a boy or girl, probably you add on. I mean, are the two down there? It's a fair question. Very, very good question to ask.
Okay. Wow. It's a fair question to ask. Let me speak to Nana Kofi. Hi, Nana Kofi. Good morning.
Hello, good morning.
How are you?
Oh, what about you?
I am doing well, thank you. Let's hear you.
I want to ask a question. I'm 2016. I had an accident, and since then I've been going to the hospital up to now, after no long. And the problem is, at first it was just a white discharge, and I've been going to the hospital for treatment all this while. But right now, I've been having this burning sensation, and I feel pains in my balls. Sometimes it gives me waist pains too.
The circumstances, I didn't get the circumstances why.
Yeah, kindly speak up a little.
Yes, was it this accident or a sexual contact?
No, a sexual contact.
Okay.
From 2016, and I've been going to the hospital. Immediately I found out, I've been going to the hospital for treatment up till now. But the problem is, there's been an improvement. I've been feeling, first it was just a discharge, but right now I feel burning sensation, I feel pains in my balls, and it gives me waist pain sometimes.
Yeah. So when we get an infection, after a sexual contact, we group the infections into bacteria, viral, and chlamydia. And the treatment is important. Time of initiating treatment and the duration of treatment is important. If we don't treat it timely and we don't treat it long enough, they may end up having the infection entering the prostate area. That is when it becomes quite a chronic one. So you have what called a chronic prostatitis, and that's what I can see you are experiencing. Now, when we come to a level of the chronic prostatitis, we've got about 3 different types. There's one type that when we go in there, we can find a bacteria that are still lingering on. That we can work on. Sometimes we give antibiotics for as long as 3 weeks, sometimes even continuously for 6 weeks. And that can be able to eradicate it, and then you can be free. But other times we can go there and we still don't have bacteria, what we refer to as a chronic abacterial prostatitis. And that can be challenging. Because what happens is that the prostate or the body system then thinks that, there's still something that I'm not happy about. So the bacteria may be eliminated, but it is still fighting against itself. And so then becomes more than what we call an immunological problem. Then becomes a challenge. So sometimes what we have to do is to keep you on, anti-inflammatory medications, give you tablets that try to relax the muscles in the prostate for you to be able to achieve some relief. So it looks as if we have got a chronic prostatitis at our hand. And probably urologists could be helpful. But I must admit that sometimes we even get to our wit's end and we don't know what to do. But get close to. If it's a chronic abacterial prostatitis, then we may have some of our medications that we may be able to give to see whether we can get some relief. But I must say that probably we have got a long distance to travel, but we will be able to help you. What we may give may not be the orthodox things, may not be an antibiotics, but we have got a few anti-inflammatory, a few prostate relaxing medications, a few anticholinergics, a few combinations that we can give you some relief. But let's see where we are in the stage. If it's bacteria, we may have to give antibiotics for longer than we've ever taken, maybe 3 weeks in a month, and that can help us. But get close to a urologist and we will try and help the situation.
Nana Kofi, are you still on the line?
I'm
Kindly give your number to Daniela, okay?
Okay.
Give your number to Daniela. We'll see how we can contact you and see who to direct you to for help, okay?
Okay.
I'll find out from Dr. Chi if he wants to take this one up
We
himself.
give
So
it a
just
try.
leave your contact, okay?
Okay.
All right. But don't despair.
Okay.
Yeah, sounds like sounds a bit dicey, but don't despair.
Okay.
As well. Okay. This one here says that, good morning. This message is directed to Dr. Che on Home Affairs. Okay, he has said, 1 CT scan showed 14 renal. Is it calculi?
Yeah, calculi is stone.
Okay, calculi in my renal pelvis. Please, I want to know if Kolibu can treat me. I am told I've got to go abroad.
Good. So
In the first place, what is the
calculi.
renal pelvis, renal calculi in the renal pelvis, yes, but the renal calculi, what's
Okay. So when we say calculi, it's just saying that there's a stone in the kidney.
that?
And when we say there's a stone in the kidney, the urine contains, it's like a salt in solution. And sometimes this salt can crystallize out of the solution, like the way we make salt from the sea, sea water. And so then becomes a salt, a stone that we can, a crystal, and it can be very big. So he has a crystal in the kidney area, the urine system, and it's about 14 millimeters. We take 40 millimeter at about probably 1.4 centimeters. That's how we look at it. Good. And it's in the renal pelvis area. Some time past, we have to send people abroad because we didn't have the expertise and the equipment to do it. If we had to do it, we had to do an open surgery to be able to move it. But that has changed. Now, this can be handled in our system.
In Kolebu?
In Kolebu Teaching Hospital, 37 Military Hospital, probably the Christ Hospital can also be able to deal with it. So Kolebu can be able to handle it. We've got a few people who have been trained outside who can handle it. So yes, it needs to be removed because it can block and prevent the kidneys from functioning very well. It can be the source of an infection, but it can be dealt. So Kolebu can handle it, and I think it can happen. It doesn't need to go abroad. We have all it takes to deal with it.
All right. You don't need to go abroad. You can have a smooth intervention here. Haven't we improved? But we still have a long way to go, don't we?
We are making progress.
Great. That's encouraging. But whilst we're at it, mothers everywhere want to feel appreciated and fulfill their traditional role as nurturers by preparing tasty meals that their families enjoy. That's why you need Onga, Mama's helping hand. Onga provides Mama with a superior taste, aroma, and flavor-enhancing ingredients that ensures that she is appreciated by the family. Onga has a concentrated level of flavor, aroma, and taste, and therefore requires only a small amount of seasoning to achieve great results. Onga is extremely quick, easy, and convenient to use. Onga, Mama's helping hand. And Roverman Productions, in partnership with Joy Prime, JoyFM, and the National Theatre, presents a brand new original Able-wide play titled I Want Your Wife. How so? Find out how so at the National Theatre on the 6th, 7th, 13th and 14th of July 2019 at 4 p.m. and 8 p.m. each day. Tickets are available at JoyFM and other usual outlets. You may also buy your tickets through Roverman Productions payment platforms. Details are on its website www.rovermanproductions.com and our social media platforms. Buy your tickets for I Want Your Wife now. Roverman Productions. Be the difference. Alright, so we will be back shortly to continue with your questions.
That every meal is a special treat.
Ah, that aroma. That chicken stew looks delicious. Need my help?
Always when the food is ready.
Onga, Mama's helping hand. Still available in 5 exciting flavors. And now in addition, new 50-gram sachets, which give you more.
If you're just joining us, this is Home Affairs on Joy 99.7 FM. This morning we've been discussing men's health. We say men's health matter. So my guests have been Dr. Yamuache. He's a senior lecturer and a consultant urologist. We've been discussing health issues pertaining to men especially. But some, interesting questions have slipped through as well. Like this one I have. It says, Doc, what are the causes of dryness during sex?
Good. So, at the climax of sexual activity, we expect that you ejaculate. And the ejaculation is a lot of fluids produced by probably 3 or 4 organs within the male system. Each one contributes a little bit of it. 5 mils there, it's 1 mil there and everything. Together, the average ejaculation volume should about 2.5 mils for a man. All of them together. If there's any blockage or any distraction of any of these structures, whether because of an infection or because of a cancer or because of an injury, an accident, then they may not contribute towards this fluid that we make. And
are we talking about the man or the woman here? The question is from a woman.
From a woman? Yeah. Oh, okay. From a woman. Then her age is important. The age is important because the secretion of fluids in the woman are produced by some glands within the vaginal area, and they are highly hormonal, highly estrogen dependent. So once you get to menopause, the estrogen levels go down, then this ability of these glands to secrete these secretions then goes down quite markedly. So then we may sort of have to introduce local estrogen, topical estrogens to be able to help the situation. In the meanwhile, sometimes you may have to use, KY gel and other things to be able to do that. So important is the age. Are we getting postmenopausal, or have you had any surgery done that has removed the ovaries? Because the ovaries are the ones who produce the estrogen. So you have got a surgery, for instance, they remove both wombs or they remove the ovaries. You have got a radiation to the abdomen area that has affected the ovaries. Then that can give you dryness. The next important thing is that in addition to these estrogens, you also need the nerves to be able to stimulate these glands to produce the secretions. So things that affect the nerves, especially diabetes. So if you are diabetic and the nerves, called diabetic neuropathy, and the nerves are not working well, you may have a problem with the glands. If you have got a severe back pain, whether from degenerative or from accident, then that can also cause the dryness. And of course, we are talking about fluid being produced. If you are not drinking enough, then there's not enough fluid for the body to use to make all of this possible. Probably the last thing I'll talk about is what we call anticholinergics. Anticholinergics are drugs that we use. Sometimes we use them to treat people who have got, frequency of urination. We use it to quieten the bladder. Sometimes we use them to help people who have got, sinusitis and other upper respiratory tract infections. So that some of the cough medications contain these anticholinergics, and all of these are detrimental to, this mucus production. So if you start experiencing dryness in your mouth, believe with me, it's likely to be dryness down there because they are all mucus things. So it's important to interrogate what has changed.
Couldn't there be psychological factors as well?
It's possible. In other words, then you are not getting to your stimulation level. Mm-hmm. Because I said, it's a nervous system, it's a hormonal system, and they are all under feedback. So if, for instance, you are not happy in a relationship, yes, it can be a reason. Yeah. If you are stressed or preparing for an exams, it can be a reason because you are not able to channel the nerves and the realization that needed for these glands to be able to work. So, yes. So apart from organic work, it could be psychological. It means that you are not getting to your climax because you really need to get to a point that you are wet. The ladies can tell something they're even wet before it starts because they have been talked into it. So if you can't get your mind to it, it can be difficult. Yeah. And I must also say that the cycle is also important. Around the time of ovulation is the time that the lady is most wet. So again, you may see that it varies depending on the ovulation level. Around the time of menses, just after menses, it can be very dry. But midway, it can get better. So again, you also have to time when you stay on for longer activities or a more frequent activity. You are likely to enjoy a more frequent activity within the time of ovulation because you are naturally wet. But just before menses and immediately after menses, that can be dry naturally because the hormone levels have changed.
Okay, great. There's one here that says that, please, sometimes after urinating, I feel like I still have some left in. Also, sometimes I urinate frequently at short intervals. Sometimes, too, after taking in water, it takes a very long time for me to pass out urine. And then he continued to say, he thinks that breathing is an involuntary action, but what psychological problem causes one to forget to breathe in a normal way?
Okay, good. Well, let's look at the symptoms he gave us first.
Yes, for the urine.
When you talk about frequency of urinate, and there's feeling of some left behind, you have to push for the urine to come. The urine flow is not strong enough, and there's a delay in the urine flow. We put all this together and call it the lower urinary tract symptoms. This is related to the lower urinary tract. The causes are varied. It can experience it in childhood, in the male, and as we get older in the elderly. So the age is important for us to put it in perspective. The common things in the age of people who are less than 40 years, we are looking at an infection in the prostate, prostatitis. We are looking at what we call urethritis, infections in the urethra, and also a stricture, a blockage in the urethra. So that is it. Between 40 and 60 years, normally the natural increase in the size of the prostate, what we call benign prostate hyperplasia, and that can be the reason. And above 60 years, then probably we are looking more at prostate cancer as a cause of the problem. So the age is important, and we need to put it in perspective. I think that if you approach any doctor at all, they can be able to help categorize what the issue is and direct him appropriately who he needs to see. Because sometimes even because of a back problem, that can be the cause of these symptoms. And once the orthopedic surgeons or the neurosurgeons addresses the back problem, these symptoms will disappear without even a need to see a urologist. So you should approach the general doctor. They will interrogate and see where to put it. Breathing is natural, and the system has been made that anytime our carbon dioxide level is going up, it triggers even a higher breathing level or rate to be able to compensate for that. So it is very natural. If you psychological people
forget to
yes, it's more psychological. It's more there are a lot of people with difficulty swallowing, and you go and do all the tests and you don't find anything blocking the swallowing. And I think that probably something more psychological. If he's on any medication that is affecting the brainstem, it could be drugs, marijuana, cigarette smoking, heroin. All these things can affect the brainstem, and that can be an issue. You can also have infections of the brainstem, viral infections. They can also affect it. So the question is he taking anything that's affecting the brainstem? Because so far as the breathing is concerned, the brainstem is in charge, and the brainstem doesn't respond to anybody. It's in control by itself with its own mechanisms. So probably a bit of psychological issues that needs to pay attention to. If he's also staying in a place that is a bit more smoky, then it's advisable that because carbon monoxide can offset some of these things. So you should watch his car. Is smoke coming into the car? You should watch the environment is working. Is it too smoky? Probably something is affecting the brainstem, and carbon monoxide can affect the brainstem and give you some of these difficulties. So that's what I'll say for now.
Good education there. Hello, Nana. Good morning.
Yeah, good morning.
How are you this morning?
Yeah, I'm good. I hope you guys are doing great.
Yes, we are. Thank you. You're there.
Yeah, I want to ask Doc, what's the normal length for a man penis? I'm asking because whenever I have an erection, my penis is 11 inches. And so most of the few ladies I've come across sexually, they keep telling me I'm hurting them when I'm having penetration during sex. And I've not had sex for like a year because I just divorced my African American woman I got married to. So for some time now, when I sleep and I wake up, especially right now, like I feel pain when I have an erection. It's been going on for the past 2 months now. When I have an erection.
The erection, I mean, with the early morning one.
Yeah.
Okay.
Yeah. I feel this pain. Second, I want to ask this question to you. Another issue is, I most ladies I come across actually made them quit during sex, and it's like they've never had that experience before. So some actually ran away from me, telling me that I made them pee themselves because they were so shy and stuff. And it seems to bother me, like it's bothering me for some time now. So this part of some of our sisters are really not really exposed to certain things and stuff. So I have to really tell them that the guy go beside me, literally, like that, and they seriously stay away from me. So it's beginning to bother me too.
Okay.
So I just need some better explanation to that.
Okay, but I mean, big on it is you want to find out what the normal inches will have to be, and also about the pain.
Mm-hmm.
Okay. So we will say that any penis that is more than 2 centimeters at erection should be able to do some work, so far as penetration and sexual activity is concerned. What I've been doing now was to try and convert this 11 inches into centimeters. And it turns out to be almost 28 centimeters. Okay, good. So that is quite...
That's quite a size.
That's quite a size. That is quite a size. Because our whole urethra from the beginning to the end of the bladder can be that long. So that is quite a size. Now, you may be born with a big penis around the family, or a small penis that runs in the family. So one of the things I always ask is, how is daddy? Because that can give you an idea what you are doing, especially if a young man comes to you. One of the reasons in an environment that somebody can get a big penis is sickle cell disease, especially the SS and the SC people.
How so?
They get what you call priapism, where there is erection that persists longer than necessary, sometimes without any untoward stimulation, because of blockage of the blood flow through the penis by the sickle cells. And as this persists or recurs, then they get what we call the mega penis, and the penis becomes very big. And I'm beginning to think so, because one of the things that they experience is pain in the penis when there's an erection, because it tends to stay longer than is anticipated. Normally, when the erection stays more than 2 hours or 4 hours, you start getting pain, because then it's becoming ischemic and there's no oxygen and it begins to hurt. So it looks as if you have got a mega phallus, and in our environment, probably what to be looking at is probably a sickle cell condition. So we need to talk to him.
Nana, are you still there? Oh, he's
going. Yes, probably that's a question
to
of
find
ours.
out if
yes. So Nana can get in touch with us. We want to understand what the issue is. Definitely, we don't do any reduction. Good. But of course, one of the things that
you don't do reduction, but you can help increase.
Probably trying to a few maneuvers here and there. So sometimes the truth is that sometimes we teach them that you don't need to use the whole length, and we decide how much you want in. So not to get the whole length, it can be another way of trying to deal with the situation. If people have actually put a ring to limit how much should go over, the danger of the ring is that sometimes if you get yourself, then it can get trapped. Yeah.
Nice.
So we need to talk to him and then understand, because if he's getting pain now and he's a sickler, maybe he's getting too many infections, maybe he's not taking good care of himself currently, because he said now there's
otherwise
there's
if he's
no
not
lady.
a sickler, what could
then we need to understand. We need to understand what is happening, because the testosterone level and everything else, most of these penis, it responds to testosterone, but by the age 17 it does not respond anymore. So we need to do that. We need to understand. Of course, it can also develop a cancer within the penis itself. So you say the penis is getting big, but it's actually cancer.
Maybe cancer.
Yeah, which is growing in there. So they can become big because of leukemia, because the cells from leukemia is getting fed up into it there.
Hey, so it is not all the time that when your penis is big that you should be excited.
Oh no, especially if it comes something recent. You understand?
Hey.
For his story, it looks like something's been there for a while. So that's why I'm looking at the congenital problems and genetic problems. But if it's all of a sudden your penis is getting bigger and worse is coming an ulcer or something, maybe there's something is going on, and we need to analyze.
There's a question here. Our time is up. This one says, please, when I get ejaculation, I don't feel the semen coming through my urethra. Do I have a problem?
Good. So it must come out, but sometimes it can flow back into the urinary bladder, what we call retrograde ejaculation. So we want to find out whether does it go back into the bladder. We are able to make that analysis by doing a urine test after sexual activity. So when you do a urine test after ejaculation and there's sperms in the urine, that can tell us that probably you have got retrograde ejaculation.
All right.
Otherwise, then we have to look at, is the nerves working well? Are the hormones very well? Is diabetic? So it comes to general nerve and vessels, which you can be able to analyze. So then it becomes a part of a general problem rather than a localized problem. So the systemic disease may be the reason.
So we have to touch down now. But before we go, mothers one more time want to feel appreciated and fulfill their traditional role as nurturers by preparing tasty meals that their families enjoy. That's why you need Onga, Mama's helping hand. Onga provides Mama with a superior taste, aroma, and flavor-enhancing ingredients that ensures that she's appreciated by the family. Onga has a concentrated level of flavor, aroma, and taste, and therefore requires a small amount of seasoning to achieve great results. Onga is extremely quick, easy, and convenient to use. Onga, Mama's helping hand. So we're done this morning. There are lots of questions here. There's one that just says, is it safe for men to hold back sperms during sex? And tons of questions we haven't been able to attend to. After the show, I'll find out from Dr. Shea if he's available next week. If he is, we just may continue. But thank you all for doing the listening. Fairboy and then Daniela. Thank you all very much. Hopefully, we're praying to see what we can do next week again. But thank you all for doing the listening and enjoy your weekend. Daniela, did you ask me to do something? Oh yes, at Sewo. Please, we'll come and visit you, okay? And get well real quick. Bye, Doc. Thank you very much for coming through.
Thank you very much.
We'll have a conversation to see what your next week looks like.
Thank you.
All right.
Yeah.
Okay, enjoy the weekend. Bye for now.